for the audience to ask questions. Thank you.
Thank you for the introduction. As was said, my name is Nandi, and my presentation will be on the attitudes and perceptions of postgraduate students towards the use of artificial intelligence in public health. There we go. So if you had attended the talk by Prof. Commerce in the early in the morning, you heard him say a few things about fear of AI integration into our daily life. So I thought this was a good contrast to kind of look at how we portray AI and how it actually currently runs. There's some poor souls behind the computer coding and putting in that code to operate different examples. Here at the University of Pretoria, we have two robotics examples. We have Libby, the library assistant, and we have the SM Wolf, who is a robotic dog that helps gather information on fruits and plantations. So I thought that was interesting to note out. But what exactly is AI? So the concept is not new and was actually established in the late 1950s. Yes, the late 1950s. And because of the limitation on technology in that time, it did not flourish as much as it is now. So AI encompasses any technique that enables computers to mimic human intelligence, to exhibit some kind of logic and decision making. So it's a broader term that encompasses multiple methods such as machine learning and its different types, deep learning, neural networks, robotics, and chatbots. And also there are different ways in the way we communicate, the way we travel, that AI is being implemented. So AI is currently expanding in medicine and public health, not only on the African continent, but globally. And usually we see this AI talk in computer science atmospheres or business atmospheres, but it is becoming apparent that AI education for students in public health and medicine is essential. So this leads us to some of the work that is already being done, that AI has been integrated as a methodology to do public health research. So on your left-hand side, you see different components of AI, and you have the articles that it has been integrated into. So it's being used in HIV surveillance, in our recent current pandemic. Also, robotic assistants have also been used in the health sector. And that leads us to the purpose of this research. So upon literature review, there's no published work that shows how South African university students perceive or what their attitudes are towards AI. So the aim of this study was to assess the perceptions and attitudes regarding AI, and we did this among postgraduate public health diploma students at the School of Health Systems and Public Health at the university. So how did we do this? We sent out an online questionnaire, and this questionnaire is an adaptation of a Canadian study that was done on medical students early last year in 2021. And we sent this during one of the modules. If you just attended Dr. Sean Patrick's presentation, we did that during his module, and we collected data over a week. And then we gave out calculated percentages and did some content analysis on open-ended questions. So what did we find? So we had a good response rate, with majority of our participants being female. And we had asked this participants on their understanding of general AI terminology. That included AI itself, machine learning, deep learning, neural networks, and only 46% showed that they had been familiar with these terms. And then when we asked if they how they perceived AI to work in different levels of health, such as individual health, health systems, and population health. 67% agreed that AI would eventually perform these tasks. So individual health can include or included monitoring of patient compliance, performing surgery, providing empathetic care, and um, 75% had agreed that AI could perform health systems tasks such as providing documentation about patients and providing recommendations for quality improved practices in hospitals. And also we looked at asking them about AI performing tasks, population health tasks such as conducting health surveillance and outbreak prevention, and 61% of those agreed that AI could do that. But when we analyzed it a little further, we saw that only 29 to 32% of those individuals who agreed that AI could perform these tasks, they said that it would occur in the next 11 to 25 years, and with the exception of health systems tasks that would occur sooner, between the 5 and 10-year mark. We also asked how they had perceived AI would affect the job market in public health. And quite interestingly, 69% of our participants said that an introduction to AI would actually reduce job availability in public health. And the raised concerns that come from, media and so forth on ethical, social, and health equity challenges, you see that the participants had quite the perception that it would definitely cause 84% ethical challenges, so 77% of social challenges, and equally with health equity challenges. Oops, sorry. There we go. So on our content analysis, some of the questions that we asked is their attitudes, whether they had negative or positive attitudes towards AI in public health. And 39% of our participants had a negative attitude towards public health, stating one, the reduction of job availability, the introduction of patient confidentiality and privacy, and what problems that may cause when AI is introduced, as well as the lack of funds to implement, to fund infrastructure, and to find human resources in order to implement AI in the sector. And those that had positive attitudes towards AI in public health with reservations. Their reservations stemmed from those mentioned, similar to the negative attitudes echoed by our participants. And then those that had positive attitudes towards AI said that it would be interesting, it would eventually come to pass, and it would probably improve service delivery for their patients, and also would be a great administrative tool in public health sector. So we asked the students, well, the questionnaire had asked the students if they felt that they were being adequately trained alongside AI tools in their current degrees. And interestingly, 52% had said that they were, but if we contrast or compare that to how many said they were familiar with AI out of 46, it was just an interesting thing that we picked up. But most of the participants had felt that training in AI competencies should begin at an undergraduate level. So training them once they get into tertiary education in AI, especially with its expansion. So the conclusion and recommendations of this study is that AI is expected to eventually carry out specific functions in public health, but it comes with some reservations, both in the challenges it may raise ethically and socially, and also a huge highlight that it may increase unemployment in the country. We do recommend that in-depth interviews should be done around these perceptions and attitudes in order to better assess how the inclusion of AI into the medical and public health tertiary education system should work. So once we understand how the students think about it, once we get to understand that more, we can then implement it better. So these are the references to the studies that I had referred to. And that is the end of my presentation. So thank you for your time. Are there any questions?
Wonderful. Thank you, Nandi. From my side, I'm just very jealous of your sample size. I think it's wonderful that you had so many willing participants. I see Prof. Linda van Looneveld posted a comment in the chat pane, and she said she's wondering whether you can provide examples of possible ethical concerns with regard to AI in public health.
Great, that is a good question. So I think the ethical issue comes in with preservation of information, so individual information. I think that's been a huge concern by a lot of people. We see it on Facebook asking us about our cookies and Instagrams and your WhatsApps changing its information laws. So I think that's where is it ethical to gather information without the individual knowing, or through different means that the individual cannot identify? I hope I answered your question to the best of my abilities.
I think you did. Thanks so much, Nandi, and thank you for keeping to the time as well. For anyone that would like to chat further to Nandi or any of the other fellow researchers, I see Liz and Dr. Sean are here with us as well. You're welcome to meet up with her in Kumo's space if she joins us there during lunchtime. Please remember, this session will now close, and then you can use the program to log into a next session. There will be a workshop that's taking place that starts at 45 past. Thank you so much, Nandi. Thank you, everyone.
Thanks, everyone. Bye.